All right, so we are streaming, and today we're going to talk about I'm Dr. Willardsen, and I'm here with Memo Hea, the director here at and CFO and director of marketing. And so today we're going to talk about practice development, marketing, show some cases, and look at the practice and development process of implant center development. So, all right, so the first thing I'd like to do is basically go through and show a couple of cases. Let me start off with, this is a patient who let's see.
I'll minimize that one.
Let's see. And in the comments, if you can...
Go ahead and minimize that program on the left.
Yes, here.
Minimize it. No, don't exit it, just minimize it.
Okay.
Yep, there we go.
We've got some comments coming on through. Roderick Tapia, thanks for joining us. He is an expert at the implant lab development.
And then now if you just want to make the whole Chrome bigger.
Okay, so this case came to me. She had spent and for what do I need to make bigger? For those of you who, whether you're dentists or non-dentists, she came to me with, this was after about, I think it was around 8 or 9 years. She had implants placed, was unable to get somebody to restore the case. So she has a denture, as you can see, and she has 10 implants on the upper jaw and no implants on the lower. And let me go back here and show you, give you an idea as to what. So this is a view of how she presented to me. So she presented to me with the denture. She had, keep in mind, she's got 10 implants underneath this denture. How she was able to clean and maintain them, she couldn't. There's no way to access underneath the palate. There's no way to clean, irrigate under here. So it was a real disaster, a mess. So I took the denture out, removed the prosthesis, cleaned up the tissue, cleaned up the implants because some of the implants were failing. Actually, I had to extract some of the implants because of, this is just so dirty. So, and the only reason I show this is, again, as we talked about on our live stream last week, the system is pretty broken. So, and she fell into that broken system. Actually, I know the surgeon who placed the implants. He's in Riverside, California. Just put as many implants as he possibly could in her upper jaw without having a real plan. There was no thought of where they were going and what the final long-term prosthetic or restorative aspect was going to be. And so this is how she ended up, and she stayed like this for about 10 years. And so let me show you what, how the case ended up. And, it turned out, I would say pretty good. So here's a smiling shot. Sorry for the quality. The picture quality is not ideal, but let me just kind of show the, oh gosh, let's see here. Just lost my view. So here is a close-up of, so you can see all of these implants. She's got a ton of implants, the design, and this was actually provisional. This isn't the final. So, and that's why it's a little mottled and not super smooth. But in the final, it was very aesthetically, looked great and smooth. And she was so happy because to have gone from having a denture that was screwed into the mouth and having spent so much money on all of these implants to finally have a prosthetic or set of teeth that she could use. So, again, it's an example of a case that ends up in a broken system where you have a doctor the surgeon's anxious to place the implants, but then they kind of wash their hands of the restorative aspect or making the teeth aspect. So as a result, that's why I say it's a broken system. It does not allow for continuity of the case. So when the patient comes in, they're like, okay, I want implants. I don't want to wear this denture anymore. And they pay the money for the implants, but then at some point they get lost in this process. And it's usually from the placement of implants, everything's good there, and then to the restorative. So, and our goal here at Trust Implants and at the Trust Media Group, our goal is to help bridge that gap and try to fill that void. And Memo has seen a lot of this as well, being such a incredible marketer and understanding the process. And we see a lot of ads where, for example, we'll see ads like this where you're going to get a permanent set of teeth in 24 hours. And, what are your thoughts on that?
I mean, just with
From what you've seen here in the practice and with the patients that we see.
Definitely that. When it's something that they do really fast, that obviously doesn't last. When you want to build something that lasts in anything, not just dental implants, but a house, you're restoring a car, whatever you're doing, it takes time, right? You have to take your time to really like we talked about last stream, is you have to first focus on the foundation and then the rest of the stuff, right? You can't start with prosthesis or anything. Like, it takes steps. But I feel like just with experience of everything, it's marketing now, right? You drive down the freeway, you see all these billboards, you get ads on Facebook, you get ads on YouTube, you get all these type of ads. And I've realized, and I've discovered, and I'm pretty sure everyone discovered, that if it sounds too good to be true, it usually is. Yeah, it's not the ideal way to go.
Right.
Even I just think about cell phone services. You get $29.99, but it's crappy service you don't get anywhere. But if you want a good quality, you pay for Verizon, which it's gonna be expensive, but you're not gonna be in the middle of I-5 with no service.
Yeah. This is another ad, and this is, and I don't even know who this company is, but $845 for an implant, and they have a picture of the abutment and the crown and everything. It's and so this is one of their ads. Now let's take a look, and I know it's a little delayed on our live view. Oops, didn't want to go there. This is one of their ads, and then this is same company, same ad. So it's a bait and switch type of a situation where they, bait you with, well, an implant is $845 or $800, but we've seen ads on the 605 freeway in Southern California that are $399 per implant. So, there's just no way that you can utilize quality materials unless you're using really cheap implants and using novice skilled surgeons for $399. So the first ad I showed you, same company, showing a implant with the abutment and crown, was $899. Here's their second ad. Oh, the abutment, crown, and implant is $1599. So the first ad was $899 was for the implant, but they mislead you with the crown and the abutment as if it's all included, whereas here it's $1599, I assume all included. But it's the only reason I show this is because it's really difficult to say every single patient is $899 or $399 or $1599. because every case is different, every patient is different, every implant position, like I say in all my feeds, is that every position, if I place a number 8 or 9, the 2 front teeth, I mean, that's a $10,000 implant for it to look like the adjacent tooth, to make it look perfect, so you cannot tell that it's an implant. Because if you spent $899 on a number 8 or 9, which is your centrals, your front top 2 teeth, and it was, and you lose that implant, or it doesn't match, or there's asymmetry in the gum tissue or the bone, it's going to look horrible. It will stand out like, as soon as you smile, that's the first thing that people will see. So patients need to understand that certain areas of the mouth are going to be more expensive, but also that the surgeon, prosthodontist, whoever's doing the case, can manage the case and knows, bone and soft tissue architecture, understands implant surgery, understands the restorative aspect. So the only reason we bring this up is because we do see a lot of, and implants have turned into a marketing machine. If I needed a cardiac procedure, I'm not going to go off of a guy that is advertising, $5,000 open heart surgeries. That just doesn't sit right. And this is an investment. It is an expensive procedure. It's a procedure that, if done correctly, is a lifetime procedure. Now let's go back, and sorry for the lack of understanding or knowledge of this system with our live view, but bear with us as we go through it. Let me show this case here. Again, similar situation. Patient went in to his general dentist, said, "Hey, I'm tired of my denture. I want implants." And so he ended up with, let's see, how many implants does he have here? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 implants. And again, I apologize for the lag, but okay, here's the photo. So he ended up with 10 implants on the lower jaw, and you notice these little gold, and I don't know if they can't see my mouse.
They can see it, and the
Oh, they can? Okay, so
on our end's not.
So here's these little gold attachments, and he has 4 of them, maybe 5. I think this is one back there. And so he got 10 implants and ultimately ended up with a denture that snapped in onto 5 implants. There's a lot of things I see with this case. So first of all, he's got a ton of implants. He should have gotten a fixed prosthetic, without a doubt. A denture on implants is just a denture. At the end of the day, it's just a denture. It's maybe 10 to 20% better than a regular denture with no implants, but at the end of the day, it's just a denture. But also take a look at the threads. You notice these exposed threads here. So that means that the implants were not placed in the right position, and he's lost bone around these threads. So what happens is, if you can imagine, because the mouth is a pretty dirty environment, right? I mean, it's not just whether it's with natural teeth, with implants, whatever the case may be, it's an environment that has to be maintained. You got to brush, you got to irrigate, you got to floss, all those things. If you don't, you're going to lose teeth or you're going to lose implants. So now imagine if you have these threads exposed, and all of the debris that's going to collect on those threads. I mean, it's like a magnet for debris. Exposed threads, and then the surface, that gray area around the implant, that's a roughened surface or etched. In this case, these are direct implants, so they're really, really cheap implants, about $100 a piece. The surface texture is very poor quality, and the implant brand itself is very poor quality. So it's just a magnet for debris, for calculus, for tartar, for bacteria. And so as that bacteria sits on the implant, it begins to migrate down. The soft tissue and the bone starts to pull away from it. And so it ends up being just a nidus for infection, for debris buildup, and so on and so forth. So, and he just followed the lead of the doctor who was in charge of his case. But ultimately, again, like we said last week, there was no quarterback. There was nobody in charge. Surgeon placed the implants, or maybe it was a general dentist. I'm not sure. This looks probably like it was a general dentist when you got when I've got 4.3 millimeter diameter implant here and a 4.3 here and then a 3.5 just snuck into the middle. There's no rhyme or reason at all into this case. And very common to see this. So, let's see.
One thing I wanted to point out, Dr. Willardsen, is
Yeah.
that, I mean, the quote that we live by here when it comes to marketing or marketing the services that you
Right.
offer is a confused mind will always say no. All right.
Yeah.
And so what you're doing now is you're not, because we just showed 3 ads, and all 3 of those ads, they're focusing on one thing, and that thing was price. They don't
Right.
focus on value. And if people go on our YouTube channels or even now our live stream, that you're explaining why it shouldn't be done that way and why it should be done this way. Like, we always try to focus on the value, and you try to explain why it needs to be done that way.
Right.
So then people aren't confused. I mean, yesterday you had someone come in
Yeah.
and I mean, if you want to tell us about that.
Yeah, so yesterday I had a consultation. Patient comes in, actually had a fractured mandible, broke off. Anyways, he had some trauma. And once and he's an upper denture, lower partial, has his lower front teeth, and those fractured off. And, once I explained to him, once I place 8 implants in the upper jaw and then 8 or 6 on the lower jaw and give you a fixed permanent set of teeth, the denture adhesives, the denture, all of that goes away. He's like, are you serious? I won't have to wear a denture and it'll be permanent and fixed and I can eat a steak or whatever? And I'm like, yeah, I mean, so I was kind of shocked at that he didn't even know it had existed.
Mm-hmm.
And also, he said, this makes sense to me very clearly. I want to start, so, but I want to make sure that, because it does make sense, but I want to make sure that my patients, viewers on our live stream understand there's a big difference and there's a big chasm between people. There's a lot of guys out there placing implants. Another ad here, and I'll show you 2 different ads. So here's an ad of this family dentistry practice. So obviously that he's a family dentist, he's a general dentist. And then another ad that they've got is their All-on-4 ad. So they show so they do family dentistry, they do cleanings, they do fillings, they do just regular conventional general dentistry. But now they've gotten into the implant game and they're showing us now what an All-on-4 is. So this family dental practice has now gotten into the All-on-4 game. And again, it's nothing against this practice, but it's a matter of, here's another way that we can make money. And the All-on-4 procedure dumbs down the process to make it so that technically anybody can do it. But like those cases I showed just now, bone loss, lack of planning, positioning of implants, all of those factors play into it. And patients are the ones who lose because, in this photo, I'm seeing a snap-in abutment here on these 2 front implants, and then possibly a multi-unit abutment with screw retained in the back implants. And, it just is so confusing for patients. And all right, so let's see here. So here's a CT scan of a patient that I took the other day from one of these centers. And so this is a cross-sectional view of of the lower jaw, cross-sectional view. Patient has went to one of these places, had implants done, and notice, so this the white dark area is the cortical bone. The middle, which is a little more gray, that's cancellous bone. This is the implant right here. So the implant is literally going through to the other side of the bone. It's not even sitting, the apex or the tip of the implant is not sitting in bone. If you look at the upper right hand corner right here, that implant is, it should have gone this way, right? It should have gone down the axis of the bone, so it's all housed in bone, but this implant is not housed in bone. It's housed outside of the bone. Of course, I extracted this implant, but it's not understanding the anatomy. It's not understanding implant surgery. It's not having a CT scan. I guarantee you this, they placed these implants without a CT, so they didn't know their angulation issues. They didn't check to see if they had perforated the lingual side or the tongue side of the bone. And I only show this because that's when you get a novice doing expert work, you end up with this sort of a result.
So, Dr. Willardsen, any general dentist can just start placing, even if they didn't go to school for.
That's why I say it's a broken system. Any general dentist can put on his dental implant hat and say, "Hey, I'm the implant guy," and that's, like some of these ads that I've showed, they're all general dentists, and so. And that's why Palomalo developed the All-on-4, is to dumb it down, stay in the safe zone, stay away from the sinus, stay away from the nerves, stay away from the infraalveolar nerve, stay away from the mental nerve, to try to get it in as many hands as it possibly can get into, because they made a fortune on All-on-4. Just the trademark name of All-on-4 alone, they made a fortune on that. And so now it's publicized and marketed all over the place. But, for patients that are, falling into it, they don't understand and they just go with, and I get it, I get where because implants are so much better than dentures, no question about it. And so, but people need to be aware of what, what the marketing is and just to know what they're getting into. Because to have a situation like this one, again, patients spent a ton of money, and at the end of the day, just ended up with really nothing. Whole case has to be redone, implants have to be removed. Prosthesis is, I don't even know what this is. I don't know what the idea of the plan was, but
the little bit that's left, actually.
the little that's left is. And also, for doctors placing implants, I mean, there's systems, there's methods, there's techniques that can really help patients to have a successful outcome and to achieve results that, that can be, the doctors can be proud of, the patients can be proud of, that's going to last, that the tissues and the body and the bone and hygiene will be optimal, because you have to optimize the environment so that the end result, the long-term result is going to last the patient. So, if we look at this case here versus the one I just showed, night and day difference. I mean, if you look, for example, up here, right where so this would be in the upper right-hand corner, if you can see the mouse, that would be where it's under the tissue. So that emerges into where the implant is, and then you screw the prosthesis down into the implant. And so that's where the tissue is. So I want to have a very clean, contoured, properly contoured emergence profile, it's called, the profile of how the teeth or the prosthesis comes through the tissue. And then the antaglio side or the underside, how it's designed so it's going to collect food no matter what. There's no way that you can do any sort of these prosthetics and not have food collection, So, but you want to try to contour it and minimize the amount of food collection and make it so the patient can maintain it and clean it so that it's long-term, will last them the rest of their life, So
And we've seen that here. I mean, we've
Yeah.
seen with the implants that we use and the prostheses that we use, it's lasted up to 20, 25 years.
Yeah.
Right.
Yeah.
And then some of these cases, they last 3-4 years and they're back here or they're here for the first time saying like, I wish I would have done it the right way the first time.
Yeah, for sure. And there are, this sort of a case, this is not uncommon. I mean, our mouths take a beating. After, like I say, at about 40, 45, things can really start to go downhill, especially if the patient hasn't maintained it. Or like in this case here, where he's lost all of his molars. And I've shown this case in the past, but this is a mechanical kind of situation. So because he has no teeth in the back and he can only chew with his front teeth, you can see what's happened to his front teeth. They have just completely worn down. I mean, he's chewed right through all the enamel, the dentin, and he's literally just, the only thing that's really left are the crowns, right? Because those are a little more protected. But the natural teeth themselves, they're done. Like, they are completely worn through the dentin, the enamel. And so in a case like this, obviously these teeth have to be extracted. Planned properly, you'll end up with a really nice result. Like, I see a case like this and I'm just like, hey, this is a slam dunk. I mean, it's very, very easy, especially when but not an all-on-4 case. Because imagine if I were to concentrate. So, I just thought of this, but with the all-on-4, the implants are going to stop at about right here and right here. So he's not going to have any implants in the back on either side. And then on the lower, they're going to stop here and here. So all of the anchors are going to be exactly where his teeth are right now, because the doctor doesn't want to go into the unsafe zone, which is beyond the mental nerve, which is right at the first or second bicuspid, and then the infraalveolar nerve runs back, and that innervates your chin. And of course you don't want to traumatize that nerve, but if you know how to work around it, if you know it's there, you've got all the imaging and CAT scan so that you can navigate around these things. And then, up back here beyond this crown here and is where the posterior maxillary sinus is. So you need to know how to navigate around that. You need to know how much bone is there, so that when you're placing implants in these areas, you know how to graft it and that sort of thing. So, and that's why proper planning, execution, allows us to deliver cases that look like this, implants in proper. Actually, this was an all-on-4 case that I got from one of these, or the choice is clear type centers. And I transitioned it into, I added 2 implants in the back, gave her, and she had a plastic hybrid, so she had a titanium framework with plastic teeth that had broken. And so I had to redesign the case and put implants in and graft where she needed it. But this is a result that will last her.
That was only on the top part, right?
Well, I did. So she had no teeth. Yeah, it's a good. Thanks for asking that. So all she had was her lower front teeth here. There were no implants in the back. So, and that's why and I could probably show the picture, but I don't know if I have it here. This was broken. It was the teeth that she came in with was all broken, and it's because they left only her lower front teeth. So it's just kind of hitting up against that, and then it broke. But by distributing the load, giving her implants in the back, more implants on the top, properly designing the case, and this is a case that will last. Whereas had I not placed implants on the back and just left her lower as it was, because this is a top and bottom, I did both, but these lower front teeth are natural teeth. The back are implants. So Had I not placed the back implants, then she would be kind of back in the same spot, you know. So, because you have to think of it like mechanically, you got to think about the design of the case and think about, you know, long term. You know, how's this going to last? Is it, you know, the biomechanics, which I always say.
Yeah. And so in the previous one that you showed, what would be the game plan on that one?
On this one here?
Would you have to add bone?
Oh, yeah, I had to add bone. I'd extract all these teeth.
So extract everything, and then you said 6 implants, or would you do more?
In his case, I did 8 implants in the upper jaw, and then 6 implants on the lower jaw.
Why?
Why the difference?
Yeah.
The upper jaw, the bone is softer, so I want more support. I want to engage that bone more securely. Lower jaw is very hard, so and that's how I often judge each case, because sometimes I'll do 8 implants on the lower jaw, but I do a minimum of 6, upper or lower. Sometimes in the upper, if the bone is more dense and I've got quite a bit of bone, I'll just do 6 implants. So I kind of just dictate according to what the patient needs and what I think, what I know long term will be most, you know, give them the best longevity for the case. So,
and in some occasions, this is while you're in surgery, right? You have a plan to go in and
yeah. I mean, it's more like when I'm doing the initial consultation and evaluating the case, looking at their, like, for example, their masseter muscles. I'll look at the masseters. If they're really strong, I know I need to way over engineer the case because they're gonna have a really strong bite. So it's just and that's why, you know, with all this marketing stuff, it's impossible for me, who's been practicing you know, built multiple implant centers and been doing this, well, first of all, trained in implant surgery, prosthodontics, but also having run multiple centers. There's just no way to put every patient in an all-on-4 box and say, oh, all-on-4 is good for everyone. It's all-on-4 is not for all. It's so, you know, I just have to navigate each case according to the patient, their personality, their condition, whether it's periodontal disease, whether it's trauma like the case I just showed, biomechanics, and factor all those things into the end result and the plan of the case and the execution of it, you know. So this is his kind of pre-op photo. So this was kind of before, and you know, and he's a young guy. I mean, he's but because, you know, he ended up in one of these corporate centers, and you know, they gave him an option: you want a root canal or do you want extraction? As a patient, what is he supposed to say? You know, like, do I want a root canal? I don't like root canals, so I'll take an extraction. You know, but without really thinking, you know, what's going to be best for him long term. So if I extract all the back teeth, and now all I have is my front teeth to chew with, this is exactly what happens. The breakdown and the wear. He's going to keep chewing. He's going to still go to In-N-Out and eat a cheeseburger, right? I mean, he's going to continue to try to live his life the best he can, now with missing molars, but he's just going to use his front teeth to do it. And so as a result, the breakdown occurs, and you know, that's what you end up with. So let me see.
It's funny you say that, doctor, because if I were to go to the dentist or just a doctor and he'd ask me that question, my answer would be a question that I would say, which one's the cheapest?
Yeah, that's exactly
right. If you give me those 2 options, and so without me knowing or being educated, I'm gonna gravitate towards the cheapest, because, you know, we all have expenses, we have everything, but yep. I don't know. But if you would say, let me give you the 2 options, why this
benefits,
is better,
yeah,
and what are the pros and cons,
yeah,
I'm gonna actually think about it, and I know the price. Then I'll say, it's, even though it's a little bit more price or less price, I want this because it's gonna last longer, right?
Exactly. And Yeah, I mean, that's such a great point. The patient's mind is already going to go towards the money. What's the cheapest? And again, I go back to kind of the heart surgery or a neurosurgeon or a brain surgery scenario. Like if a neurosurgeon came in and you needed brain surgery and there was two options and you based your decision off of, well, what's the cheapest option? I mean, that's crazy, right? I mean, that's like, I mean, you want the best option. You want the very best result. And in fact, you don't really care what the price is. But that's why I say the system's broken, because dentistry and medicine are completely separate. So when you go to a cardiologist or a neurosurgeon, they're getting paid the same kind of no matter what, right? They're working for the hospital, they're working for a system, they're working for the man. And so they're going to, ideally do the very best thing for you, give you one option and say, this is what we need to do. We're going to schedule surgery on this date and we're going to do it, and that's it. And you just go along with it, right? But in dentistry, it's not that way. You have multiple options. So in this case with our patient here, he was given the option of root canals or extraction. He probably went with the extraction because it is way cheaper. But the end result and the effects on his mouth long term really were more negative than positive. So he ended up spending a lot more money long term because of the decision that they offered him of a root canal or an extraction. And oftentimes, a tooth's so far gone that root canal is not an option. But at least talk to the patient about what the long term benefits are one way or another. And in the end, he was great. Like, this is his after photo. We fixed everything. He has implants, and he's good to go. So, but at the end of the day, it's really just educating the patients on what's best for them. And one other photo. This is a little on the graphic side, but I wanted to kind of show this because this is such a rookie picture, and this is just from the internet. But they've put all these implants and they're concentrated in the front. But these are just Snapin implants. In fact, it's a one-piece implant that you cannot take the part. Like in my implants, I can remove parts and pieces. I can screw in a set of teeth. But these are just little balls that a denture snaps onto. So they have 6 implants that the denture snaps into, and they're all concentrated in the front. Again, no rhyme or reason, no thought, no planning, just literally all around the cost. I mean, you probably said, I'll put implants in, I'll do it for $15,000, and didn't tell the patient what they're getting because they're getting a denture that's snapped in. But so just be careful, be cautious, be wise. We're trying to build a platform to help people gain knowledge, gain understanding, end up with, let me just show this last picture here because we're out of time. But, this is a solid case. Patient has plenty of implants, good bone, good hygiene, good design, good implant position. And this will last her the rest of her life. I mean, I can't guarantee anything because in the body it's hard to guarantee anything, but it will. This is a very solid prosthesis, solid implant position, solid design going into it, and grafting and extractions and whatever was necessary to get her into this stage. And so, it's money well spent. And here's her after photo. And she's, in fact, she's just a wonderful lady who was so grateful after we did her case, was life-changing, able to chew and eat again, suffered with what she had for years and years and years. And within about 3 months, we fixed that. We fixed everything. So, but it was executed properly, designed properly, using the highest quality of materials, the highest quality of prosthetics, and getting a very good long-term result. So,
yeah.
So today we've kind of talked about a lot of things, marketing. Be aware of the marketing that's going on out there. Understand what you're getting. Understand, why that marketing is going on. I mean, there's a reason that they're doing it to kind of, pull you in, getting you teeth in one day. The final set of teeth in one day is, there's just not a lot of customization and planning in that. It's not that it's not possible. It's just kind of out there, and I would caution everybody around that. So again, if you have questions, comments, just ask us in the comment section. Hit that like button, follow us for more content, and I think we're all good for today.
Yep. And then if anyone wants to learn more, like Dr. Willardsen said, we're here to educate. We're here to just help people make the best decision. Go to our YouTube channel. We have Dr. Willardsen has so much content
A lot of
there.
content, yeah.
We continue to put content there, and it's content like this. Like we have our anesthesiologists that we bring in, because that's something that's also very necessary in the procedure,
Yeah.
right? In order for this to go smoothly. So just things like that. Feel free to go on our YouTube channel. And if you want to have Dr. Willardsen review your case, you have x-rays or anything like that, send an email to info@trustimplants.com.
All right. Well, thank you guys, and we'll see you next week, Wednesday, on our next live stream. Have a great week. All right. How do I turn it off?